As you know, as a man, like who has, your spouse or your girlfriend or whoever,
your sister,
or whoever you're with,
or even your daughter,
or even your
daughter.
Yeah. Like what exactly is it that we need to understand? Like when a woman, for example, is going through that, like because when they tell you this is what I'm going through, most of the time, like we are blank.
Don't get it.
We are blank. We're like, you're in pain. Like there's no context that we have.
Give her medicine and run.
Yeah, so
not even medicine.
Yeah,
even just going to buy pads for your partner is important.
Correct.
I buy pads for my daughter.
Do you hide?
Yes.
Do you hide when you go to the store?
No, I don't. Why should I hide?
No, because kuna saa zingine unajua unafaa kujificha ndio usionekane umebeba stay free.
This is something which is natural.
Yes.
It is something which is normal.
Yes.
And actually that blind spot that you're talking about, if she is bleeding that heavily, anakuambia Ali, hebu enda uninunulie pads.
Yes. Don't ask a question.
No. Hiyo sio kazi yangu. How do I go and buy pads, These are things which are supposed to be normal, which are supposed to be okay.
Okay.
So those very heavy periods, when they start those heavy periods, the next thing that we want to ask is, are there any clots? Because usually very heavy periods are accompanied by clots.
Okay.
Even by that alone, by 50% of the time, I know there is a problem. I know there is something which is touching on the lining. That is why this lady is having such heavy periods.
Okay.
But sometimes it does happen that the fibroids are huge and the lady is actually asymptomatic at all. She does not even know that she has fibroids.
Okay.
The periods are regular, no problems at all.
Okay.
Now, the other thing that we ask about when we think that they are fibroids is whether there are any pressure symptoms. Because sometimes, if the fibroid is in front, what you call the anterior portion of the uterus, it will actually touch on the bladder. So the lady feels that she needs to go to the loo. When she goes for a short call, she has finished, but after a few minutes, she still wants to go back.
Okay.
And when she goes there, nothing really comes out. The same thing when she wants to go for a long call. Sometimes, if it is what you call a pedunculated fibroid, which is sticking out onto what you call the outer opening of the womb, of the uterus, it can actually mimic cervical cancer. So it will look like it, the structure looks like it, even the smell sometimes, like rotten meat, but it is really actually not cervical cancer.
Yeah, and there's some questions here that are coming as you're speaking. There's actually one particular one, as you've mentioned, cancer. It's coming from our Diaspora Youth Caucus.
Yes.
And they're saying this is a serious problem. I was just wondering if HPV-18 is cancerous in women and is equivalent to male infertility because men live in denial. Let's start with that.
HPV will come back to it. That's our topic by itself.
Okay.
So let's first do the fibroids, then go to HPV.
Okay.
Yeah.
Yes.
So we'll get back to your question, Diaspora Youth Caucus.
So heavy periods, clots, pressure symptoms. Sometimes we ask, or we do ask, whether there are any issues during intercourse, because again, where this fibroid is located and how big this fibroid is can actually bring discomfort to the patient when she's having intercourse. How long have you had this problem? What about in your family? Your sisters, maybe your mother, did she have these fibroids and so on? So once we've had that history, then the next thing we want to do is basically we want to do a vaginal examination. And that vaginal examination, remember, this is a very intimate and very
exam.
Yeah. So we want to do it in a place, it's intrusive. We want to do it in a dignified manner where we respect the lady, and of course we want to have somebody there such that, of course, men, not only men, there have been some cases whereby health officers, medical staff have actually molested women. So we want to have a chaperone there with you when you're doing this when you're doing this exam. We want to tell the patient exactly what we are doing right from the word go all the way. And something else which we need to also to ask before we even go to the examination is, when was the last pap smear done, which is also something which is very, very important. Pap smear in Kenya, about 4 or 5% women have actually had a pap smear done.
Talk about pap smear, because remember we're talking about blind spots for men.
There we go.
Yeah.
And that actually will be connected to the HPV, that we are talking about.
Okay.
So when she comes for this test, these are some of the things which we want to cover, because sometimes she may not have that pap smear done at all. So once she has presented herself to you, this is something which you want to do. So we do that we take that pap smear. Once we've done that, is then we actually examine, with our fingers and with our hands. Somebody say that actually for a gynecologist, the fingers are the eyes that actually see. And there's actually a lot of information that I can actually deduce by just, examining using my fingers. I will know where this fibroid is, what the size is approximately, whether there are any other changes in the uterus, if there are any other changes in the ovaries, and so on.
Yeah.
Once I've done that, now I want to confirm what I have examined physically. I'll send her for a scan. And this usually should be a transvaginal scan. I want to emphasize here. Why? Because a transvaginal scan, when you're putting in the probe inside the vagina, the waves actually are very close to the uterus, and the information they get from there, that is when it is changed into a picture which I can see, and the picture is big, and then I can actually see what is happening, as opposed to a transabdominal ultrasound, the one which is done through the abdomen, where you are told, go and drink at least some, a few cups of water, and when you feel that your bladder is full, that is when you come for the scan. That one is not as accurate as the transvaginal scan.